Good morning, all. My name is Carolyn Harshman. I'm the second vice president of IAEM-USA. It's my pleasure to be introducing you to the Disaster Cost Recovery and Finance Caucus's webinar on the topic of disaster cost recovery related to COVID. And I just want to say that this particular caucus is one of many different caucuses, committees, and ad hocs within IAM. I encourage you, if you're not members already, to consider becoming a member for services and benefits just like today's offering. The PowerPoint will be posted on the IEM landing page, along with other related COVID resources. All of our webinars, and you'll be able to actually watch the webinar as well. All of those resources are available on that same landing page. So with no further ado, it's my pleasure to introduce you to Mike Martinet, who is the chair of the Disaster Cost Recovery and Finance Caucus. Thank you, Mike.
Good morning and good afternoon to everyone this afternoon. Well, format today will be mostly the same, but we're going to jump over reviewing the handouts. They've essentially not changed since 2 weeks ago, and they are available on the IAM website to both members and non-members. And I want to thank Beth Armstrong for allowing us to share this with our non-member colleagues. And with that, this being our final scheduled COVID-19 Cost Recovery Caucus call, I want to shift the focus ever so slightly to less of a tactical or operational basis to a slightly more thoughtful focus as to where have we been the last 4 months, where are we likely to be going over the summer, and what might we need to think about relative to a possible, we hope not, but a possible resurgence. And then as many of the people who work in the cost recovery consulting arena have experienced in the last few weeks, the impact, the dramatic and unexpected impact of the Black Lives Matter movement. And I'm hearing from agencies saying we're overwhelmed because we're now dealing with two disasters. And so with that, I'd like to start with our Dean of Panelists, Ernie Abbott. Ernie has a rather extensive background in this and was the chief counsel at FEMA when there weren't a lot of attorneys there, frankly. And Ernie was chief counsel in the Clinton White House, and since then has worked on the side of local government and local agencies to do battle with him when they wanted to take money back or denied funding. And Ernie, your floor is yours.
Thank you very much, and I guess I can state what is obvious to all of us, that this has been an extraordinary, 3 months. On March 13th, President Trump declared a national emergency, and then he mentioned the Stafford Act as part of that declaration, and effectively made a determination that the public health of protection against disease was a matter that was under the Constitution and laws of the United States a matter of primary federal responsibility. That was a sort of a historic designation, since it had never been found before, and I think we've not had a disease event of this significance certainly since the 1918 flu. We've had trillions of dollars of funding, and it's kind of interesting when you realize that Congress has enacted about $2 trillion, I believe, of new federal money already. of which a relatively small portion, 45 billion, I believe, was provided to FEMA for the traditional, we'll call state and local response to a disaster event. And then a big tranche was also given to the CARES Act funding, and then there were whole bunches of other appropriations designed to go to some of the economic impacts. We've had situations where the need for personal protective equipment and ventilators by eligible applicants was, in a sense, being, we saw a competition between federally funded state governments, federal government agencies, and even hospital applicants, all trying to get the same commodity and all eligible for federal funding, which led to Defense Production Act designations that were being at least coordinated by FEMA. And we've seen some real changes in some of the ways that FEMA does things. The issue of duplication of benefits, how does FEMA prevent applicants from getting paid twice for the same thing, is always a very obvious and objective. You don't want people to get paid twice when they only spent it once, but FEMA has traditionally interpreted that as not a question of whether you actually got paid twice, but whether there is another entity out there that had authority to pay you even though they didn't. And so they would not provide funding if there were another federal agency that might have authority to pay you. And FEMA, I think, has now stated that for purposes of COVID-19, they are not going to administer that duplication of benefits provision in the traditional way, even though you might have some eligibility under the CARES Act. It's not going to be interpreted that we'll deduct the funding that you might have gotten from the CARES Act from whatever it is we would provide under the normal Stafford Act funding. So we've seen some responses to the confusion that everybody has in trying to make decisions on which funding source they go for, when the guidance and detailed guidance on what those different pots of money can be spent on has been, we'll just say it's being modified as experience goes forward. So I think what we're seeing is an agency which is really under stress at FEMA, with all states activated, and yet we're beginning to see the normal project worksheet process moving forward. Get applications, PWs get submitted into the grants portal. Requests for further information are coming back, and it is beginning to seem a little bit more normal as the process is going on. But I think we're going to see some real strain on FEMA's ability to manage the scale of the decisions that have to be made within the time frames that, frankly, everyone is expecting. So we're going to still have some big challenges going forward, but at least there's, I'd say, a light at the end of the tunnel, as we're beginning to see that social distancing did work to bring down the rate of disease. And although there is risk of a second wave, I think we can be encouraged that the nation has finally responded.
All right. Thank you, Ernie. And we'll come back around to all the panelists. And if you have questions, please go ahead and start to submit them now, and we'll get to them as we roll through the panelists. Next, I'd like to ask Margaret Larson to give us her thoughts on where we've been and where we might be going in the immediate near future as best we can see. Margaret?
Oh, Mike, the crystal ball, right? And some of what I want to say reiterates some of the points that Ernie made. We are all in a position of trying to articulate and working to document FEMA eligible claims following the policy guidance, regulations, and laws that are in place. And there's a lot of rumor, discussion, and hints that FEMA might weigh in on things one way, and it may not necessarily coincide with the exact guidance that we and precedents that we followed for emergency protective measures in other disasters and other events. And so that's, at least with the clients I'm working with and people I'm talking to, with colleagues who have clients outside of who I'm working with, that's consistent with what they are finding to be the case, and it makes sense given how everyone is trying to get their arms around this. But it doesn't detract from what we know, and what we know is documenting is going to be a requirement. Documentation and clean submissions to FEMA that answer all the questions they're going to need to see answered, and information provided to document and tell that story. The narratives for writing project worksheets and writing the work are really important. And so thinking through the narratives, using words that are ones that FEMA appreciates and allows, is also how you phrase what you're doing does matter. Sort of the what you say, it's not what you say, it's how you say it. In this case, it is what you say. Sometimes can trigger a question from FEMA and maybe push them to thinking otherwise. But just know that everyone is in the same position of trying to figure out the unknowns. The CARES Act funding is one because it is 100%. In many of the cases of what's being provided, it's 100%, whereas FEMA is 75-25. You're trying to figure out the priorities around where to use and allocate the CARES Act funding compared to FEMA. It's still, that is causing concern with everyone and confusion as well. So really, again, just prioritizing if it's FEMA eligible and documenting accordingly, really understanding that eligibility and pushing that forward. But the conversations on a strategic budget decision, especially as you have politicals, whether it's a board of supervisors, the city council, or they're asking for questions, they need answers, they're driving policy, they may be driving operational decisions, and that is certainly, I'm finding it to be a universal concern that's coming up with a lot of the people that I'm working with. But that big fiscal impact, the loss of revenue with entities and subrecipients as they're applying for this, the reality that they can't fill vacancies, that people are being furloughed, is really hitting hard across the country, or at least with all the clients that I've been talking to. These are things that are consistently coming up. I think that we've even started deeming the discussion about future planning as continuity of government, continuity of operations on steroids, because everything with that worst case scenarios that were planned for have hit a new high on the demands on what business continuity looks like, whether it's reopening of schools or reopening the buildings that government operates out of, and how do you have a public interface when it's a public serving entity that has to have interaction with the public, and what does it look like to even set up partitions, and how do you document that? How do you show what was reasonable in your costs? And that's becoming a really big discussion point too. Cost reasonableness when a lot of the commodities that are required are so much more expensive than they were 6 months ago. And so that's something that's hitting, putting together that documentation. How did you come up with reasonableness? Repeatedly coming up. The magnitude of this event is one that FEMA is going to really struggle, I think, to keep up with reviewing everything that goes into the system. As Ernie indicated, the questions that are coming back from FEMA and trying to get answers to them and them having time to review, there's a lag time. There does feel like there's some normalcy starting to flow in that, but the timelines may be a little bit longer. And then the question about duplication of benefits, if it's FEMA eligible and CARES Act eligible and another federal funding source, some of what we've been hearing is that FEMA is going to look at what is the delta. Did you pursue the funding from CARES Act in a way, as example, you would with insurance and get the claim reimbursement through that process? And if there's a delta, then FEMA will look at funding that. But that's just another example of issues to be worked out. I think for now, I'm going to, Mike, turn it back over to you so Asif can have a chance to talk.
All right. Thank you, Margaret. And joining us this morning for the first time from Ernst & Young is Asif Huda, who is a manager. And Asif, I've got to apologize. I printed your bio and I left it upstairs. My apologies. If you would do a brief self-intro and then talk about what you have seen and what you think you may be seeing based upon your client experience.
Yeah, definitely, no worries. So as Mike stated, my name is Asif Huda. I'm a manager with Ernst & Young. For about the past 5-6 years, I've been working within our insurance and federal claims services work stream. And I work with a lot of local and state governments, assisting with their FEMA PA recovery, Section 404, 406 mitigation, as well as their insurance claims. And currently, of course, we are assisting some clients with their COVID-19 response and recovery. But to reiterate what Margaret and Ernie stated, the biggest things that we've definitely been seeing with our clients are an issue with the duplication of benefits, not really knowing where to use what funds and if there is going to be an overlap and how to document that overlap. And as Margaret stated, kind of figuring out where that delta is, because FEMA is going to be the last source of funding when it comes to these other sources as well. Another thing we've really kind of seen is our clients are trying to now go back and track costs that they originally either didn't track or didn't know could be considered eligible, and they're dealing with that and now going back and how to document it, how to then provide maybe a narrative to FEMA and understand certain costs that they didn't even know existed. And that guidance that's coming out from FEMA, and I feel like now FEMA has a better foothold and is going in the right directions. As you can see, the new POP-G came out, version 4, and in it, they do talk about backfill and furloughed employees, so they kind of understand. FEMA's kind of now getting that traction where they're understanding additional costs that are coming in that maybe they weren't originally thinking about or weren't in sight. And the same thing as again, Ernie and Margaret have stated, documentation has been key, and documentation will potentially be key with now costs being submitted to FEMA and this project applications going into FEMA and the RFIs coming back. We've noted that a lot of our clients are now trying to submit costs that potentially may or may not be covered, but they're providing documentation around it, showing why they deem it COVID related and directly COVID related within the emergency category B declaration, trying to document that, whether it's communication from state and local entities telling them, whether it was from the public, local public health organizations asking them to do certain testing sites, whether it's testing sites or certain response items, documenting all that, documenting the communication, getting that out there to FEMA along with all their costs, which will in turn potentially hopefully get them those funds, but also may cause FEMA to take more time where they're having to determine if these costs are eligible or not, which could potentially at the end of it delay funding for certain types of activities. But yeah, like Ernie and Margaret said, they basically took all my notes and kind of went out there. So I'll turn the mic back to Mike.
All right, thank you, Asif. I'd like to put a question, since our question box at the moment is empty, but standing by. It's my observation that to some degree, the CARES Act requirements may be a little less stringent than FEMA's normal requirements. And I'm basing that on the fact that within the CARES Act language, as I've read it, sometimes the language says, if the chief executive determines, or as the chief executive determines, these are necessary and reasonable costs. And that's just not FEMA-esque language. Ernie or Margaret, Asif, any of you have any thoughts on that? That CARES Act may be a little less stringent than FEMA's requirements for the same cost?
I mean, it's quite interesting. I originally had thought that FEMA would be faster getting dollars out the door than HHS would, because FEMA had an existing program with existing rules, and they just had to apply their existing program and existing rules, and they could, process applications for funding. And the money that went to HHS basically was for a program that didn't exist. They had no rules. They would have to make up how they were going to do it and then start to implement it. In fact, the CARES Act was a lot faster in getting money out the door initially, because they basically used measures, how much for hospitals, for example, how much had been provided in Medicare spending in the prior year. And so they just divided it up based upon, divided the amount that they put out in their tranches based upon past year's performance, as opposed to looking at what were specific needs that they were trying to fund. And that obviously makes it a little bit difficult to try and figure out what was the HHS money for when you're looking at duplication of benefits. We thought that it would clearly be at least one area it could certainly go to is for lost revenues, which were very significant. I would say FEMA was a little slower because, in fact, they have all of these rules and policies, and they also went through a system where you start out. It went through the public assistance program, which is a reimbursement program, which means that you have to incur the costs, and then you have to document the costs, carefully document the costs, and submit it up for reimbursement. And I want to reiterate Margaret's comment that it's very important how you phrase the costs that you're incurring to make sure that it doesn't sound like it's something ineligible or sound like it's something that it's not, to make sure that it fits within those FEMA eligible buckets. So I would say FEMA, the CARES Act maybe is a little bit more forgiving in terms of the general language, but I've also seen a large number of modifications to frequently asked questions guides that are coming out of HHS as they're trying to be a little bit more clear about what it is that they're doing. I don't know if that answers your question, Mike.
It does help, Ernie. Yes, thank you very much. Margaret?
I'm thinking too, I mean, because the guidance is constantly being updated, at some point, there has to be some oversight that the federal agencies are providing, giving this amount of money. So even though it seems like it's less stringent right now, I have not seen OIG, Office of Inspector General guidance coming out. It doesn't mean it's not there. I just haven't seen it yet. And so if we can get some plans from the Office of Inspector General that they're issuing to their regional teams how they are to approach such a massive amount of funding with so many subrecipients. If we can get some of that guidance, we might be able to understand long range what the documentation for even CARES Act might be. And even within FEMA and Department of Homeland Security's OIG, understanding how they're going to approach this from, you know, everybody in the US responding to and submitting information into grants portal. So I think we should not be surprised when some stringency gets clarified.
Good point. Asif.
Yeah, and I just wanted to add to that, as Ernie stated earlier, that FEMA is more of a reimbursement program, and CARES Act has given funds up front where you get reimbursed on FEMA, so you're going to submit the documentation just to be able to get the funding to you, whereas the CARES Act has been provided and you still have time to use that funding. So you may not have the documentation yet, as it may not have incurred, but one thing we have been telling our clients is to go ahead and track and document those costs as you would probably document FEMA related costs. Is if additional information does come out and guidance comes out on what type of documentation is going to be required, then you're ready. Then you have it, rather than running back and forth and trying to get it and potentially may not have it at that point.
And I think Asif makes a good point that it's probably best to play it safe and perhaps document everything you can to FEMA standards, knowing that those standards would probably, because they are so strict, probably qualify for documentation requirements under any of the various CARES Act funding streams. I've got a question here from our vice chair of our caucus, Christy Crosser. What time frame are we looking to for funding? And are there any thoughts on getting funding with possible increases in the weeks and / months ahead? Margaret, why don't we start with you this time?
Mike, is that specific to FEMA or every federal agency that has funding out there?
Well, I'd suggest probably both. I mean, well, obviously a lot of the CARES money is already out there, but I think it's probably more to FEMA.
And so I can speak a little bit on CARES and the jurisdictions under 500,000. There's money that's being allocated to the states. California is still working on how it's going to be. They've given local governments dollar amounts to anticipate. It just hasn't started flowing yet. So that should be coming out pretty soon. By pretty soon, certainly within the next couple of weeks is what we're being told. With FEMA, I've seen a project worksheet submitted and 50% under expedited projects being funded, and I've seen some money flowing from a couple of those project worksheets. So stuff is getting in the system. I think that it's really how quickly it flows is in part how quickly you get in the documentation that's needed for telling FEMA the story for them to review and then to start moving money. So it's a guessing game to some degree, but the complete package that really answers all their questions is the first step in that right direction. So the documenting of it. And if it's an expedited project with 50%, there could be some financial relief pretty quickly provided to you.
Okay. Thanks, Margaret. Ernie, anything to add on that?
I mean, I think we are beginning to see on some of the bigger projects for some of our applicants that, you know, it's being seriously, PWs are being seriously looked at. We're getting some questions back. We're starting to look at, okay, what kind of a delay is there once you get to the $1 million queue? So if the dollars are going to go up to Washington, FEMA has sometimes had trouble moving stuff quickly. I've heard, okay, word of mouth reports that the $1 million queue is being handled much more quickly than it had been for some of the regular non-COVID PWs, but I don't have a firm. I haven't seen it yet in terms of a PW actually being obligated in that sense. I think that FEMA is trying to move it quickly, but it's a huge amount of work that their systems normally require in order to get money out the door. There's a lot of steps that have to be taken.
Yeah, and I think you bring up a good point, Ernie, that I don't imagine that anybody within FEMA or any of its consultants ever imagined designing a system to meet the demands on the scale of COVID-19. I mean, it was spotty disasters, and let's face it, our worst recent experience was the year with the 3 major hurricanes, and they were overwhelmed by that. And so this is in another universe of possibilities. Asif, any other thoughts on that funding stream and speed or lack thereof?
Oh, sorry. Yeah, well, so the same thing as Ernie said. Unfortunately, we haven't seen any projects yet that have gotten to the obligation stage. One thing that we are seeing our clients do is to submit projects that potentially would be funded faster, at least go through FEMA's review quicker, which would be supplies or equipment, which, documentation is already there because the funds have already been spent. The review process may be a little bit easier on the FEMA side of it. So those could get obligated quicker and hopefully get funded faster. The labor and those other costs that are not clearly stated within FEMA guidance as eligible, those may take a little bit longer to be obligated and funded. So trying to run with the easier ones, I guess, would potentially help with that funding. And then, like Margaret said, going with the expedited funding projects, which will get you the 50% up front.
Okay, and I'm going to exercise my prerogative of chair here and just throw something out regarding the likelihood that many agencies are going to have to cut positions in the coming year because of the huge revenue losses they've incurred. I've talked to cities where it's $1 million on one conference alone that got canceled, to a city estimating $50 million, and another major West Coast city that I talked to, they took a hit early on of $1.7 billion in estimated tax revenue loss. So there's going to be some cutbacks broadly across the country. But I'd like to suggest that for our emergency management and cost recovery colleagues, you probably have a very strong argument that my position should not be cut, because we've got a double down on disasters currently in this country, and we have no idea what's coming around the corner. So if there's even a hint of your position being in any way reduced, I would say you've got a absolutely rock solid argument that if they ever needed you, they need you now. And then let's see, we've got another question here. And I think this has been partially addressed, but we'll see if there's any other further comments. Any suggestions on preparing for this audit, round of audits that will inevitably come, and maybe not in 2020, but it could be in 2, 3, 4, 5, 8 years down the road or more. And one of my thoughts on this, before I turn it over to the panelists, is that if your state gets a lot of money, that's an increased risk factor for audits, because auditors like to go where there's money. And secondly, this is an election year, and depending on what happens in the election, there may be some paybacks for states that aren't on the winning side this year. as an additional risk factor. And with that, I'll go back to Ernie. Certainly you have your experience with audits, Ernie.
Well, you're setting me up for a tough one. I mean, what I would say that what we're really seeing right now is that the needs that are being created out there, and you talked about lost tax revenues, lost cancellations of events. There are a lot of things that COVID-19 has caused that are having a major economic impact on local governments, nonprofits, just businesses all around. And most of those items are not things that FEMA is going to be paying for. So to the extent emergency management is focused on the kind of dollars that you get from FEMA, you have a statute that basically says we pay to fix broken stuff. That's Section 406. We pay to increase the resilience of stuff so that it won't be broken. That's your mitigation pieces. And we pay for these emergency protective measures. And FEMA's struggle has always been on emergency protective measures to say, how do I, it's a slippery slope. How do I not pay for everything? How do I make sure I'm only paying for things which are caused by the major disaster or the emergency? And so we're going to have, maybe another round of looking at those CDL loans, the community disaster loans, which are used to try and fund revenue shortfalls caused by an event. Normally, those CDL loans don't provide the need that is, don't satisfy the needs that are out there. After Katrina, Congress enacted the special community disaster loan that provided a much higher limits. Maybe we'll see something like that. And those items generally had a opportunity to forgive the loans if various measures are met. And at the moment, the economy looks like the various measures might be met. So I would say that those are the things that I see are really happening. Your comment about getting ready for audits, I would probably, other than repeating what we've all said about documentation, make sure that you have kept all of the records about what you're spending. But that may be a good segue to one of my fellow panelists.
And before we go to Margaret, just last week, I worked with the agency where they're trying to formalize an agreement between the agency and a food bank. And this was an issue of having the proper language in there. And so we have to be careful, if you're creating these agreements now after the fact, did you get that language correct? Margaret, your thoughts, please.
I'll start with the initial question on preparing for audits. Just for audience sake, Ernie and I are former colleagues from FEMA. While he is the lawyer, I was in congressional, and Asif and I are former colleagues at EY. So it's a nice bridge to have both of them on the call, and our perspectives that we have some similar experiences from those two places. But and Asif, I'm sure, can add a lot more on the audit side. But from the time, when we enter into an engagement with clients or not, just giving advice, is to think about what is your risk factor when you receive federal dollars. And you can look in-house even at your prior audits and see if there are any findings, material or not, but findings around your management of federal dollars coming in, and assess whether or not you have some risk factors that have been addressed or have not been addressed, and see what they are in terms of managing both CARES Act, but certainly the FEMA money. That's something that you can get a quick glimpse of how unusual is the amount of money that we're receiving now from the federal government compared to our normal budget. And that right there can cause some risk factors. Again, I'm not an accountant, but these are just some things that you can think about when you're looking at, do I have some risk? And then where can I clean up if there have been prior findings to make sure that we prevent those problems from occurring again. The other thing is to understand what the OIG is looking for. There is a capping report that the Inspector General puts out, and I think the last one was about 2 years ago, but it's the common issues that FEMA finds after a disaster when they go in and they're reviewing for whether or not something's to be recommended to be deobligated. The capping report will cover consistently what's happened over that course of review. And so I think that's a good one to look at for preparing for the audit itself. The other is when you realize there is a gap or there may be an issue that you need to address, the memos that you create that are contemporaneous can help you also put together why something was done. So let's say you had to take a corrective action measure because you realized, for example, maybe you let a contract or a procurement and it did not follow all of the FEMA and the federal government requirements within it. It doesn't contain all that language. Put together a memo talking about what was done, and then also what you're doing to bring it into compliance moving forward, and what is your plan. So there are things like that that you can do. The contracting and procurements is always a very big issue. So that's one that you want to look at carefully and look at everything that you're purchasing during this event and try to strategize and prioritize which ones might be your biggest issues and start addressing them like that. So you can even look at them in terms of, this one we know is a big problem. Let's get to it. Let's put something together, and then do the same with the rest of them.
Thank you, Margaret. And if I might add, pay attention to the small print. And unfortunately, the Federal Register is always in small print. I looked at a document, a draft document, where the attorney involved said the record retention requirement was 3 years from the date the invoice was paid. And that's not it. It's the 3 years from the date your last project worksheet closes out. So that small print can be very tricky. Asif, your thoughts, please.
Yeah, definitely. Well, since Margaret and I work together, she kind of stole my answer. But adding to that, though, the documentation is really key. Getting all the documentation up front, starting the disaster or the recovery process with the documentation in mind, and understanding that the OIG is going to come in and audit. If that mindset is set from the get-go, it's going to be easier to get that information together and understand what you'll need. Like Margaret said, going to the Oig Audit Reports is a great resource. This way you can see their findings from their last audit or the two audits prior to that, and you'll kind of realize exactly what the OIG comes in and looks for. Procurement definitely always has been a big issue with COVID and this declaration. I know that FEMA has let you forego policies and procedures to go with the emergency exigent period reasoning behind procurement, but again, that requires the applicant to document why and how they forwent their own policies. So having that is going to be key. And I think one thing that people do end up forgetting is these audits don't occur for 5, 6, 7 years down the line. And there's going to be turnover wherever you are. There's going to be turnover. There's going to be people that were here during the disaster, but they're not going to be there for when the OIG does come in and audits. And having that information ready to go in a format where anybody can pick it up, understand it, and provide it to the OIG is going to be key. Because if it's stored in a manner, or it's formatted in a manner that was just for a specific person to be able to provide, they may not be with the city at that point. They may not be there and be able to provide that OIG audit in an easy format, and then that's when you'll have issues, or it may take longer to get through that audit.
Asif, you made an excellent point there of what I would rephrase as the decay rate of audit necessary information. Today, it makes perfect sense to you, but your successor may not be able to make heads or tails of it if it's not complete, thorough, and properly organized. So that's a great point to be made. This is slightly a repeat question, but I want to readdress it a little bit. Is how soon can smaller jurisdictions receive a disbursement? And I think this is typical for a lot of people. Our deficit is around 12 million and we are cash poor, which Ernie, maybe you talk just a little bit more about the disaster, community disaster loan as these folks might use it.
Yeah, I talked about community disaster loan. Off the top of my head, I don't recall if FEMA has even activated that program for the COVID-19 disaster event. It's basically a program that allows applicants to get a loan because their tax revenues have gone down. Their ability to their economic situation has, because of the disaster, become very dicey. They need money to pay payroll, and it has a statutory limit in terms of how many dollars you can get under that program, which makes it somewhat unhelpful for many applicants, and that's why it required a statute to make it more usable after Hurricane Katrina. So I was suggesting that there are going to be such major economic impacts that's one area where there is an existing program which has historically been used in cash flow, revenue kinds of problems. Otherwise, the Stafford Act is not really very good at addressing those kind of problems.
Is that something that has to be added into the state federal agreement, or does a community simply apply for it?
If the program is activated, I think it would probably be covered by the standard FEMA state agreement. I'm sure that the FEMA state agreement is relatively boilerplate and would have the provisions that work if all of the FEMA programs are activated, and then you only use the ones where they are.
Okay. Because that would be a category B, would it not?
No.
No.
It may, I don't even think it's under the public, it's not a category. It's a separate program, like the public assistance program is a program. Community disaster loans are a program, and it is something that I see unless the CARES Act funding is really able to satisfy the need which is out there, that is not possible to get squeezed into the eligible work for category B and B work. I would see that's a place where we could see legislation, and it would probably be before the election.
Okay. It might take some local political involvement to move that if it's not readily available.
Yeah.
Okay.
And one thing people have mentioned, the PAPPG has a new PAPPG that has come out, and remember that by its terms, the PAPPG is only applicable. The version 4 is only applicable to disasters declared after June 1, 2020, and so although one can cite to anything which is different in the new PAPPG and say, well, this really just clarified former policy, anything which is new in the new PAPPG does not apply to all these COVID-19 declarations.
Yes, good point. Good point.
Mike, on that, just really quick, because different states running their applicants briefings, we are starting to hear differing stories on that. So just remember that what the guidance says and is in writing, you should look to that for making points if you're hearing something different from either states or even FEMA regional folks. For example, specifically, we've heard that one region is talking about using the Papa G for COVID, which clearly, as Ernie said, that's not how it's intended to be. But also just even on some of the questions about eligibility in different regions having different opinions on it. So if you are talking to colleagues, your fellow emergency managers in different parts of the country, and you're hearing a different story, it's really good to discuss those and learn what the issues are, because it can help you articulate in your narratives for eligibility and know that there's precedence elsewhere for maybe getting to a yes. So it's great that IAM and places and organizations that allow for cross-pollinating and discussing of issues, because it can help you with actually getting through the FEMA process.
Good, good. Now, Margaret, Margaret and I had a pre-webinar conversation before we got on this call, and you brought up something about a couple of California agencies. Did you want to bring up any discussion on that?
Sure. The two big issues that are coming up we're getting clarification on. One is the non-congregate sheltering operations. There are a lot of items that are eligible in congregate sheltering that are listed as ineligible or not included in non-congregate sheltering, but we're starting to get some clarity from FEMA on allowing some of those other expenses because they're reasonable, and you can't run this kind of operation for a pandemic without having, for example, shampoos and cleaning supplies and other such things. So that's one that we're working to get specifics from FEMA as to what they consider to be reasonable and inclusive in those project worksheets that we're writing up. So there may be more to share on that as we move forward, but many, obviously cities and counties are working on their non-congregate sheltering operations. So that's a big one. The other is eligibility around contact tracing as an emergency protective measure. It's one that fits within FEMA policy for eligibility, and there's just been some discussion around how much is FEMA going to pay for it versus will it be covered under CARES Act. So another one to document for both of these, it goes back to the documenting and tying it to FEMA policy and narrating in a way that would tell the story with a cost reasonableness factor to it for FEMA to review.
And on that, the issue of responsibility, one of the tenets of FEMA eligibility is that it has to be the legal responsibility of the agency. And for COVID tracking, contact tracking, while many cities may want to do the right thing, unless they have a city health department, it may not legally be their responsibility. It may be the responsibility of the county health department. And that could give FEMA a reason to deny that funding for contact tracing because it's not a city responsibility in many cases. Obviously, if the city has its own health department, then that would be otherwise. But even though it's probably the right thing to do, you have to understand that doing the right thing may have to be done on the local dime rather than on the federal dime because it's not your legal responsibility. And with that, we're almost to the end of the hour, and I would like to make just one other comment, and panelists, please feel free to jump in and beat me up if you disagree. This is an election year, in case anybody missed that. And so when we talk about things still emerging in policy and legislation from the Congress or FEMA or the White House, we don't know what rabbits may be pulled out of a hat in the coming months prior to the election that would increase funding, reduce certain requirements, certainly not all, but certain requirements. Disasters, as one of our illustrious FEMA directors, I believe, said, all disasters are political, but we try to keep them from being partisan, which is very difficult these days. So that's just a thought that the sands are still shifting, even as we're trying to navigate across the dunes. And with that, I'll ask for any closing thoughts from any of our panelists. Ernie?
I mean, I think this has been an extraordinary combination of a nationwide infectious disease epidemic, which is causing FEMA to do things that they really don't like doing on emergency measures. They have been funding large amounts of money to build hospital or ICU facilities to deal with the cases of COVID-19 projected to show up, many of which are used only minimally. And so are those eligible emergency measures even if they're not used, or are they not? FEMA's put out a specific guidance with respect to that. The additional public safety requirements, as we've been grappling with the impact of the Floyd killing, protests across the country. Those have not yet led to any declaration. They certainly are going to have a political impact. It may be that there would be some kind of a declaration which would come, although they are very, very, very rare for public safety items. And I think the last kind of emergency management question mark is going to be how significant is the hurricane season, and how is if there are major hurricanes that hit the United States during this period, how can we manage those responses using the same models that have traditionally been used, when frankly the federal response force is probably exhausted at the moment, and it's just going to be a very difficult environment, even without having to do your response in as socially distant a way as you can. So we've got a lot of challenges coming up, but I also think that the nation should be at least trying and of a mood to respond to protect us all.
Thank you, Ernie. Well said. Margaret?
Well, I won't duplicate Ernie's well-stated comments there, and the politics of this. Certainly, we've seen major changes happen in leadership based on disaster response in years prior. So I think that is yet to be seen. I do want to just kind of circle back on one thing that's still an open question for FEMA use of funds and CARES Act use of funds that is pending. I've had conversations with some of the people working on whether or not CARES Act funding can be used towards the 25% non-federal cost share for states, and question mark remains on that, but also on whether or not it'll flow down to the subrecipients. It looks like from my conversations that FEMA is having negotiations with the Hill to know if that, and see if it's an allowable authorization of the funds and the decision whether or not to do it. So that's something pending that might provide a little bit of financial relief. It would be similar to community development block grant funds being allowed to be used for the non-federal cost share if that's the case. So I know that wasn't a wrap-up comment, Mike, but it was just one that I thought might be helpful to hit on.
Well, we appreciate that. Thank you, Margaret. And Asif?
Yeah, so I know that everybody's been dealing with COVID and just trying to do the recovery portion of it. And I feel like maybe there's a bit of a lull coming up right now. And it may be a good time for entities to kind of start reviewing their preparedness plans and kind of reviewing what has been done, at least through this pandemic, that worked well, things that didn't work well, and types of costs that were incurred, and maybe get ready for a potential future second wave, which we hope won't come, but it may be beneficial to kind of get ready for that in case something does come about.
Yes, yes. And with that, we're about to close the hour. And Miss Carolyn, would you do the honors, please?
Yes, it is definitely my pleasure. You can see on the screen the resources, the COVID related resources, as well as the disaster cost recovery webinars. We've had several so far. This is the last planned one for now, but who knows what the future will hold. Thank you so much to our sponsors of the webinar, the Mike's Disaster Cost Recovery Company, as well as AG Witt. So with those postings and all of today's comments, I wish you well, and keep an eye out for additional topic discussions, whether it be a webinar or some other format. We're here to help. So everybody take care and stay safe.